Good evening, Mr. Paul M. Cunningham and dear members of ISL. Today we have Mr. Paul M. Cunningham from IEEE. So I would like to welcome you all as one of the past president of ISL and one of the past chairman of electrical sectional committee for 4 sessions, and of course as a IEEE member. So Mr. Cunningham is the director of the IST Africa Institute and president and CEO of International Information Management Corporation. Paul is a visiting professor, International University of Management in Namibia, and a visiting senior fellow of University of Wales. His research interests include social implications of technology, ethics, leveraging technology to address societal challenges related to health, food security, energy and education, and entrepreneurship in Africa. He is 2018 Chair, IEEE Humanitarian Activities Committee, and 2017 President, IEEE Society on Social Implications of Technology, member of the IEEE Global Public Policy Committee, an IEEE SSIT Distinguished Lecturer, and an IEEE Access Associate Editor. He is a member of the Institute of Directors in Ireland and a former Board Director of Professionals International. He is a graduate of Trinity College Dublin, Graduate Business School, and the Kodaly Institute, Hungary. The IEEE SSIT Distinguished Lecture focuses on social implications and ethical issues to be considered when designing interventions in resource-constrained environment. So this is a very important subject, and unfortunately I have not seen many members in the audience. So these are very important today in the context of today's environment. When you as engineers, when you design something, when you plan something, we need this. But it's really unfortunate with the strong membership of 20,000 members. So today we see only few. So please take this opportunity, this ISL lectures, participate in lectures and get into discussions with the experienced people. They are very experienced people having global experience. As engineers, I have seen in Sri Lanka, most of the engineers in our members don't get this international exposure. So it's a very serious issue when you come to senior positions. You don't have a good network, you don't have a global network. So it's like you are in the frog in the well. So this is one of the serious issues. So take these opportunities. You will very rarely get one of the president of IEEE society. We very rarely get presidents of this caliber in Sri Lanka. So I have been, I'm also IEEE member, and I have been to many seminars and Power and Engineering Society exhibition in Texas and various places in US. So the way they organized these are very high level functions. So thank you Paul coming to Sri Lanka and coming to ISL to deliver this lecture, and over to you.
Thank you very much. Thank you again for that answer. Yeah, if you all hide up at the front, that would be good. And then maybe if there's any questions or comments at the end, we can have some discussion. Agwina Accordia is Misha Paul and Cunningham. One of the things that I'd like us to think about today is how we communicate and with whom we communicate. And language, culture, religion, all of these things influence the way that people perceive and understand what we have to say. My mother always told me, Paul, there's a reason why we have 2 of these and 1 of these. And I think it's very important that we consider how we understand the world around us, and particularly in a context where we're looking at co-design. So I have a lot of material, but what I'm going to do is I'm going to speak for the next 30-35 minutes. And then if you have any interest in having a further discussion after that, I'd be more than happy to do that. So for those of you who are not familiar with IEEE, we're a global membership with almost 418,000 members in 160 countries around the world. We have contributions through conferences, technical documents, periodicals and journals and standards. And the one that we all know very well is Wi-Fi, but it's only one of many. And then there are 4 areas where we focus on making social impact. And those are, I think, important. Global public policy, as engineers, you understand how important it is to have benchmarks and have ways of making sure that things can be understood and can be applied evenly. Global sustainable development and humanitarian technology, continuing education, and personally, ethics in technology, I think, is underestimated in terms of how important it is. I have a multidisciplinary background, and the only reason why I mention that is that influences the way I think, it influences the way I communicate. So it could be that when I am trying to express an idea based on your history, your education, your societal and cultural norms, you may or may not process that information in the way in which I intend it. And that's also true for me. When you're sharing knowledge with me, you're trying to communicate in a specific way, but you're never quite certain at the time whether or not what people understood is what you meant to communicate. And I think that's something that if we keep that in the back of our minds when we're thinking about co-design, I think that would be something useful for the future. In terms of my society, of which I have the honor of being president, Social Implications of Technology, it's one of 46 societies and councils. It's one of the horizontal ones. So essentially, we complement all of the other more technical, narrowly focused societies across our community. And we focus around 5 key pillars, being sustainable development and humanitarian technology, which is the center of gravity around my presentation today, but equally ethics, human values, and technology, which I'm also going to talk about today, because you cannot separate those 2 concepts. I'm also going to allude to technology benefits for all, societal impact of technology advances, and then sustainable technology. And our society has been around for the last 45 years. We're very good at thinking. We're very good at analyzing. And what I've tried to get us to focus on in more recent years is actually acting as well, because there's a difference between one and the other. And the Humanitarian Activities Committee, of which I have the honor of being chair this year, was established a number of years ago as an ad hoc committee reporting to the IEEE Board of Directors, and now is established as a standing committee. So we have a budget of $1.25 million a year, which is a very small budget when you consider the number of members that we're working with around the world. But the key thing is that our mandate is about strengthening the capacity of members, volunteers, staff, and organizational units across IEEE who are interested in contributing to or are already contributing in the sustainable development space. And one of the areas that I think is extremely important is partnership. So that's why I was very grateful that we had this opportunity, not just to contribute at an IEEE conference this week, but to be hosted at the Institution of Engineers of Sri Lanka, because it's extremely important. John Donne said, "No man is an island." I come from an island, so I'm already aware of that. And I think it's very important that we look at partnership opportunities between different institutions, some of which may be national nature and some of which may be global in nature. We have a lot to learn from one another. So we support members in 3 core areas. One, in terms of education and mentoring. And that's something that if you have an interest in contributing in that area, I'd be very interested in following up with you. The second is in terms of supporting events. And then the third is in terms of supporting projects that are carried out by volunteers with local communities. The Sustainable Development Goals are a framework that all 190 signed up member states, including Sri Lanka, are using to benchmark. They're benchmarking progress at a national level, and they're also benchmarking progress themselves with other similar countries around the world. And while this is something that was put in place to support governments, it's very important for all of us to at least understand. And the primary reason for that is that as engineers, as technologists, and as scientists, we have a responsibility to work with government to both inform, influence, and help implementation of policy. I know that some people find government difficult to work with. I spend a lot of my time working with government, and I know how challenging it can be. But I also know that if you can align your objectives, whether as an institution of engineers to Sri Lanka, whereas as IEEE, or whereas any other body, if you can align what you're doing with national policy, it is much more likely you're going to be impactful, and it's much more likely that the efforts are going to be sustainable. One of the misnomers with the UN Sustainable Development Goals is where people talk about doing a health project or doing an education project. And I just use those as two examples. So in this case, that would be SDG 3, health, and SDG 4. The simple reality is there is no such thing as a health project or an education project. What you can have are projects that have a center of gravity in a certain area. So let me illustrate why I believe that's true. And everything I share with you tonight, I'm not saying that I'm right. I'm simply explaining to you what I believe based on my experience, based on evidence that I've experienced over the last 20 years. So if your experience is different to mine, please don't be shy about sharing that with me and with your colleagues this evening, so that at the end, if we have some discussion, we can have a full and frank exchange of views. I'm currently coordinating a health project with ministries of health in 4 African member states: Ethiopia, Kenya, Malawi, and South Africa. It's supported by the African Union, by the European Commission, and our objective when we secured the funding was to find whether or not technology adoption at primary care level, whether or not that could reduce maternal and newborn health care. In Africa, death rates per 100,000 are between 490 and 573. And that compares to the UN standards, which is 70. So obviously, they're very high. What we have found is that having co-designed the solution to address maternal and newborn health care, the clinicians then said that to be fully effective, we needed to take a more holistic approach. We needed to address other conditions, both in terms of infectious, non-infectious, and other types of conditions that people would experience. When you look at the impact of trying to reduce maternal mortality rates, you think, yes, you're saving lives, but you're also causing other problems. Why? If more people are living, you're putting pressure on food security, you're putting pressure on agriculture, you're putting pressure on the education system because more people will survive to go to school. You're putting pressure on energy, you're putting pressure on the environment. So we started with an initiative that had a center of gravity in health, and now we're having to address nutrition and other areas as well. So the point I'm making is that just as no man is an island, you cannot do a project just around one SDG. There are interdependencies, and there's 169 objectives that underpin these 17. So again, if this is something that you would be interested in learning more about, I'd be more than happy to engage with you after today. Earlier this year, I started a landscape analysis around the activities of IEEE volunteers around the world. And the reason for that is that because we're such a large organization, the simple reality is most of the time we don't know what's going on. You know what a society chair is doing, or a society president. You know what a section chair is doing. But in many cases, we're not aware of all of the activities happening on the ground. This is just a snapshot, and this is just preliminary. But there are 2 things that are very striking to me. The first is that you can see the percentages add up to much more than 100%. So that illustrates the point I've just made. While there are projects about education and energy and sustainability, they are obviously addressing in many cases more than one of those areas. Okay? The second thing that's important is that the more we engage with people, the more new projects we find out about. So even though the Sri Lanka section, for example, responded and gave information about projects that were happening here, by coming here and spending the last couple of days here in Colombo, I'm finding out much more about projects that I never knew existed before. And why is that important? Because if you're trying to support a community, you must first of all understand what the community needs. And the community needs in many cases will be illustrated by the type of projects that they're involved in. We have a specific program that's unique within IEEE called SITE, Special Interest Group in Humanitarian Technology. And this is unique because you do not have to be an IEEE member to be a member of an IEEE site. So as long as there's 6 IEEE members, any number of non-IEEE members can be part of a site. So if you're part of a site, there is access to funding to support doing implementation projects. So I'm offering an open invitation to any member of the Institution of Engineers of Sri Lanka, whether you're an IEEE member or not, that if you're interested in the area of sustainable development and humanitarian technology, if you would be interested in either leading or contributing to initiatives that would address societal challenges here in Sri Lanka, you are very welcome to join that community, share your insight, share your relationships, and I hope that we will be able to work with you to address those societal needs here at home. So we currently have site groups working in 40 countries around the world, and it would be great if when I come back in a year's time for the TENCOM conference, which will be hosted, that will be hosted in Kerala, and that there will be a lot more activities going on here in Sri Lanka. Collaborative open innovation is the underpinning philosophy behind what I've been describing to you. The idea that by bringing together stakeholders from different perspectives, you're much stronger than if you act individually. So one example of collaborative open innovation is the creation of technological innovation from outside an organization. And coming from Ireland, a snowboard probably means as less to me than it does to you, but a snowboard is an equivalent to skis. It's now a $700 million industry around the world that was not created by a sporting company. It was created by a sporting enthusiast for whom walking down the side of a hill on 2 sticks, carrying 2 sticks, was not exciting enough. And they wanted to go on a board where 2 feet are planted on the board, you have no sticks, and you simply slide down the mountain. But that whole industry came out of an innovation that was not part of an organization creating sporting goods. So that's an example of open innovation, where innovation is happening from outside the organization. There are different types of innovation, ranging from technological, business, aesthetic, learning, and social. But critically, what's important is the innovation that is relevant to the community that you're working with. So in other words, it's not what we think is important, it's the end user community that you're working with. And that end user community could be a poor community, it could be homeless people, it could be anybody who is dealing with social challenges that are relevant to Sri Lanka. Okay? And essentially what we're looking at is framing those societal challenges through the eyes of the other. Not how we see them, but how they see them. There are different types of innovation stakeholders that can be involved in this kind of interaction. So we're all familiar with government, the public sector, education and research, universities and institutions such as yours, the private sector, skills, innovation funding, and so on. But there are others that may be less familiar. So NREN, National Research and Education Network. So they are frameworks that facilitate purchasing power for universities, for example, to buy internet access at much lower cost than they would buy if they did it on a standalone basis. And then the concept of community. So in other words, involving end user communities as part of the innovation life cycle rather than treating them as people who are simply there as beneficiaries. And this is about the concept of co-design appropriate, relevant interventions. Instead of designing a product and then showing it to people and asking what they think, co-designing the product from the very beginning. Going and talking to people, listening to people, learning from them what is important to them, and then using an iterative process by which, instead of taking a year to come back to you to show you a device, I'll come back to you in a week and I'll show you on paper a prototype that you can then give feedback on, and then iterate further, come back to you in 2 weeks and show you something more advanced, so that by the time whatever the innovation is ready, essentially it's already yours. You've already given as much input as possible. It's essentially your creation helped by others. And that leads us to the concept of rapid prototyping. So instead of taking 6, 12 months to do something, trying to do things on an iterative basis where you're rapidly prototyping, you're getting feedback every week, 2 weeks, so that over that 6-month period of time, it may take longer to implement than you would in a traditional life cycle, but the likelihood of success and take-up at the end of that cycle is much higher. So this brings us the concept of communities. When people submit proposals to the Humanitarian Activities Committee, they often cannot explain one simple concept, and that is, why did you decide to work with those people instead of working with these people? Which, to me, is a very simple question. And typically, there are two positive answers to a question like that. One, you know someone from that community. They trust you, you trust them, and therefore you have a basis for a dialogue. The other is to engage with a community that is within close proximity to where you're based. So the idea being that it's easy to engage. If something goes wrong, it's very easy to go and fix the problem. And it also facilitates this rapid prototyping or iterative approach, because it doesn't take you 3 hours to drive to where the people live. It requires a consultation process to identify what are the unique characteristics, because the simple reality is you can't just take a solution from one country and put it in another country and expect it'll work out of the box. There's always some level of adaptation required. And that requires an engagement process, and it requires using what I mentioned earlier, listening. Why? Because if you listen and learn, and if you can then go back and show people how you've taken account of their input, it builds trust. There are 3 reasons why any project will fail. 1, technology push. In other words, I have a hammer, so that's what I'm selling. I'm selling a hammer. Okay? 2, there is a lack of acceptance, which typically has to do with people not understanding what you're trying to achieve in the first case and not being consulted early enough. And 3 is sustainability. So I suppose what I'm proposing is an engagement process whereby by engaging early and often, you build the level of trust so that by the time the project comes to a conclusion, you get the best compliment of all. And that is, somebody turns around to you and says, thank you for helping us solve our problem. Now, in one sense, you might think, well, hold on a second. We brought a lot to this. They wouldn't have been able to do this without us. But you're missing the point. The point is that if they believe that the project is theirs, it's much more likely to be impactful, it's much more likely to be sustainable, and it means that they have taken local ownership. So to me, that's the best complement of all. So how do we develop an implementation plan towards trying to achieve an objective like that? Well, the first is obvious. As engineers, you need to have clear objectives, you need to have a clear target audience. You need to be able to articulate the concept and the overall approach, and you need to be able to explain what the innovation potential is. People need to understand what the impact is likely to be, and then you need an implementation plan. So there's nothing different about this to any other project that any engineer would do in a professional capacity. So this brings me on to looking at ethical considerations. And this is something that I think is extremely important, but at the same time is very context specific. So let me talk about context for a moment. The prime directive from Star Trek, which is a very famous, very, very old science fiction series. The prime directive was the prohibition from interference with the natural, unassisted development of societies, and the prevention of the use of superior technology to impose external values, ideals, or cultural norms on civilizations below a certain threshold of development. So I suppose the closest example to that would be if you look at what happened when the conquistadors went to Latin America, went to South America. They had technology that made them look like gods compared to the level of technology that was available to people. I think it was Albert Einstein who once said that technology at a certain level of advancement is indistinguishable from magic. So the concept here is considering the appropriate use of technology. Asimov is one of my favorite science fiction authors, and his least famous law is Law Zero. And I think considering all the innovations that are happening with non-human intelligence, artificial intelligence, and machine learning, the laws of robotics have never been more important. And Law Zero is about a robot may not harm humanity or by inaction allow humanity to come to harm. And then the Asian tradition, the motto that he or she that saves a life is responsible for that life. So if you save my life, and if I do good, do I get all the credit, or do you get credit for saving me in the first case to do good? Similarly, and even worse, you save my life, I do evil. Who's responsible for the consequences? Who's responsible for the evil? Is it just me? Or is it also the person who saved my life? So this brings us to the concept of unintended and unanticipated consequences. Because the simple reality is we never understand enough about any situation we're in. We're having a dialogue, and I am tuning my presentation to a certain degree around your body language, micro-expressions in your face, the way you hold yourselves, whether you're engaged and whether I should move on to another topic, or whether there's confusion. But again, the simple reality is I'm from one island, Ireland, you're from another island, Sri Lanka. We share a lot in common in many respects, but unless I've spent much more time in Sri Lanka and you've spent much more time in Ireland, it's very likely that there also could be misinterpretation. Okay? So that brings us to the ethical conundrums. When is it justifiable to break the prime directive or not apply Law Zero? What's the minimum threshold of development where the introduction of superior or transformational technology is warranted? What's the potential effect of the introduction of external values or ideals? Who gets to make such decisions? And then who takes responsibility for the inevitable, unintended or unanticipated consequences. And this, I think, is the fundamental weakness of most good that people do. People will do things because they believe it's the right thing to do, because it's charitable, because love your neighbor. There are many motivations why people would do things. And in my experience, if you expect good things happen. And most people would prefer to be treated using the golden rule. Treat people the way you'd like to be treated yourself. But the simple reality is we cannot anticipate all of the things that can go wrong. But we need to at least take responsibility for considering them. So that's why I'd like to briefly talk, as I start to wind up, around ethical research principles. And we might say to ourselves, but we're not doing research. We're doing a project, or we're just helping out. But I think if we were to apply some of these principles, perhaps the impact that we would have and potentially the negative impact we can sometimes cause could be more manageable. So there are certain principles that I'd ask you to consider. The first being to follow research ethics when you're collecting data from people that will inform the project or the solution, when co-designing product, services, and business models, or when you're creating new intellectual property. The second thing being the concept of informed consent. And the way I look at this is informed consent is just another way of being polite and being respectful. Participants should be clear about how the data or input that they give will be used, so they can decide whether or not they wish to participate. They should understand what their rights are. In other words, they have the right to say, I'm sorry, I'm not comfortable with this, I don't want to participate, without feeling any social pressure to do something that they would not otherwise do. And it's good practice that you would record informed consent. So typically when I do an intervention with people, for example, I would prepare a very simple document, a single page that says who I am, what institution I'm representing, what the project aims to achieve, what we are asking the people to do, and that they have the right at any stage to say, I'm sorry, I was okay until now, but from now I'm not comfortable anymore and I want to stop. And then there are 2 copies of that single page document, both signed by me, both signed by them, and they keep 1 copy. So it means that I have a record to show that there was a proper consultation and that people understood what we were trying to achieve. And they have a record, including contact details, so that they can then get in touch if they want to get in touch either during the process or after the process. It doesn't take a lot of effort to put an informed consent form in place. And if any of you would be interested, I'd be happy to share with you templates that you could then modify to make them suitable for Sri Lanka. The third issue relates to protecting participants. And this really relates to taking responsibility. So this is something I was talking at a workshop earlier today at the Region 10 Humanitarian Technology Conference at SLIIT that's taking place today, tomorrow, and Saturday. And that is about not targeting what I call vulnerable groups. So vulnerable groups to me would be children. They would be people with any form of disability that would affect their judgment or could affect their judgment. Prisoners, people who don't otherwise have control over their lives, and people with serious illnesses who, for those reasons, may not be their normal selves and therefore may act differently if they were not ill. The simple reality is that children or people with certain types of mental handicap cannot provide informed consent. They simply do not have the level of maturity to give informed consent. And therefore, my advice would be to try to avoid working directly with children if at all possible. And that's also part of a recommendation that the IEEE Board of Directors has signed off on that will take effect from next year. And that's to protect you and also to affect those stakeholders. And then there's an issue called ethical approval. And again, this is something that may be required in certain circumstances. So typically, if you're working with vulnerable people, or if you're collecting a lot of personal data, and particularly if you're collecting health-related data, you typically would have to request ethical approval from an institution. That institution typically could be the ethics board of a university, if you're associated with a university, and then typically there's also an ethics board associated with the government, from whom you can ask permission as well. But again, that is only necessary under specific circumstances. In conclusion, I'd like to share a little insight into the work that has informed why I believe the things that I do and the ideas that I've shared with you today. So I'm director of the IST Africa Institute, which was founded back in 2002. And that is now a strategic partnership with ministries and national councils in 18 African member states. It's recognized by the European Commission and the African Union, and it has been co-funded by the European Commission through competitive tenders since 2006. And essentially we have achieved impact in three key ways. We've helped bring over 170 million euro of research funding into African institutions. So why is that important? Reversing the brain drain. So the most talented students, particularly in resource-constrained countries, have the opportunity of getting scholarships to study abroad. And that can be a good thing, and that's to be welcomed. But the potential problem with that is that very often when they are doing their academic studies, their research will focus on the needs of the country where they are studying, from whom they receive the scholarship. So if they're in the United States, it could be around objectives of the National Health Institutes of Health or the National Science Foundation, and the European Commission, it could be the European Framework Programme. So the advantage of trying to bring research funding into universities is twofold. One, it provides an opportunity for the most promising students to have an opportunity to focus their research attention on societal challenges at home. And secondly, by facilitating building a research culture in those universities. I don't know enough about Sri Lanka, but in Africa, even the best universities still very much have a tenure track around teaching. So if you're teaching 100% of the time, you're not doing research. If you're not doing research, the opportunities for students to learn from you by doing collaborative projects is reduced. So this is partly about influencing the vice chancellors of the universities to change the culture in the institution so that it's possible to develop tenure track around research activities as well as around teaching. The second area of impact that we focused on is in terms of strengthening the policy and strategy capacity of ministries. And that's where exchanges of value between countries of similar areas of evolution makes a lot of sense. So to give you an example, in the cybersecurity field, it's very important that certain processes are put in place, and I'm sure there are certs and things like that that the Sri Lankan government are evolving here. So in the case of Cameroon, which is in the center of Africa, it's that country there in the middle, where that country there. They have made a lot of progress in that area. So they were able to share that insight with other IST Africa partner countries that had not got that far. And the opportunity was not just to save time, but also to save resources. So instead of it taking up to 5 years to put these cybersecurity programs in place, it was possible to do it in a year to 18 months. And obviously, you know that trust and confidence in the internet is very important from a socioeconomic point of view. So obviously, putting those processes in place is important. The third area that we've focused on is in terms of supporting innovation. In an African context, if I take Kenya, for example, 42% of graduates 2 years out of university in Kenya don't have a full-time job. And it's not because they're lazy, and it's not because they have a bad degree. It's simply because there are not enough public sector or private sector jobs. So the only way to address that is the traditional Irish solution, which is you leave Ireland, you work in Germany, the UK, the US, you develop your career, you have your family, and then at some stage you come back to Ireland and you set up your own business. That's the traditional model. We've always exported our talent. The other model is to develop an entrepreneurial culture so that it becomes acceptable to set up your own business. And that's something that having public sector and universities setting up innovation spaces to support graduates to set up their own industry and their own businesses is important as part of that culture change. I mentioned the health project, mHealth for Africa. So I'd just like to share one or two thoughts about that just before I finish. What we have built on top of that is an activity by volunteers, IEEE and non-IEEE volunteers, in a site belonging to our society. And essentially what they have done is we have built relationships with 4 universities. University of Gondar, which is the north of Ethiopia, Strathmore University, which is a Jesuit university in Nairobi, a Chancellor College, which is part of the University of Malawi, and Nelson Mandela University, which is in the Eastern Cape, one of the poorest parts of South Africa. And essentially what we have done is we've built a relationship with heads of department, professors, and graduate students, where they're now volunteering to build digital literacy at health clinics within close proximity of where those universities are based. So many people think that digital literacy is you're able to use a smartphone. But I think you can understand that if you're a nurse in a clinic, trying to capture information, using 2 fingers to type and not knowing where the letters of the alphabet are on the keyboard is not likely to be successful if you're trying to do a consultation with a client over 15-20 minutes. Therefore, for us, digital literacy is the ability to use at least 6 to 9 fingers so that you can both type and you can also establish eye contact. Why? Because just like this, we need to build a relationship. You need to understand, is the patient comfortable or uncomfortable? Do they understand what they've just been told? Do they want to ask a question but they're just too nervous to speak? So obviously establishing eye contact is very important for the nurse, and at the same time she needs to have enough confidence that she can type without that. So that is the nature of the volunteer activity that those site volunteers are doing. So I hope that that has given you some ideas to think about in terms of why I believe that co-design, in other words, having communities informing and working with you to evolve solutions is an appropriate way to go, and why I feel that considering ethical considerations is something that we all have a moral responsibility to address. I'd be very happy to discuss any issues you'd like to. Very much. So I don't know what's traditional. Do you have any questions or comments?
Ethical issues in research, I think we are very serious about that. Even with the Institution of Engineers Sri Lanka organized the invention program for school children. Even
that's a very good idea.
Finally,
Yeah.
participates in the international competition in US. Ireland is also participating. I have met many friends from Ireland. We are working together.
Excellent.
And now, from last year, we are very strict on this. The students have to go to university research boards and get the clearance for this medical treatment.
I think that's very important. I mean, where I've come across this having negative consequences in Africa is very frequent. So, for example, our partner in Uganda, which is the National Council for Science and Technology, there were so many university students from the US flying into Kampala, going up country, doing work with the village for a week, 10 days, handing out t-shirts, getting pictures taken, and then going back home. They were not supervised. Nobody in Uganda knew who the hell they were or what they were doing. And what they found was that they were disturbing the environments. They were doing two things that were wrong. First of all, they didn't show the respect of asking for local partners on the ground to help them understand the nuances and to support what they were doing. But what they did that was even worse was they showed people how technological innovation could help their lives, and then they were either stupid enough or arrogant enough to say, well, thanks very much for your feedback, took their innovation, stuck it under their arm, and went back to the States. If they had left the innovation in the village, there was some basis for forgiving them, because to me there is nothing worse than showing people the future, showing people hope, and then taking away by, well, you know, thanks very much for your feedback, hope you enjoyed the t-shirt, I'll send you the photograph. So I'm very glad to hear, first of all, that there is this type of collaboration with Ireland, and I hope that we can maybe facilitate doing even more of it. And I'm even more glad to hear that this is something that your institution and the Sri Lankan government find is very important. Any other questions or comments? In which case, thank you all very much indeed. It was a great pleasure to be with you, and I very much appreciate the opportunity to speak to you today. So what I will do is I will send you a copy of the slides, and then perhaps you could publish it on your website, and for those people who weren't able to join us today, they can download them, and my contact details are there so you'll be able to follow up with me. Okay? Thank you very much indeed.